Dr. Lilinio.
Mr. Deputy Speaker, sir, I stand in support of the motions raised by Finance Minister Mr. Heng Swee Keat. Today, I'd like to speak on the Finance Minister's announcement on the overall national effort to better support our aging population. MOH will take on policy ownership of the spectrum of aged care services across both the health and social domains from April this year. I agree with this new approach, provided the agendas and the targeted outcomes are spelled out clearly from the beginning and the execution details are adhered to in order to achieve the desired aim. I shall elaborate. I would like to request the relevant ministries to use this new approach to enable our seniors to have healthier and happier lives. Lives where seniors with increasing years can still enjoy active, healthy, and fulfilling days, can still live in their own homes and environment within the community, and can still have little or no dependence on institutional care. Many seniors prefer such independent living with their loved ones and friends in the community. This is achievable by advocating preventive health care. The ideal outcome will be a happy populace living well and gracefully. I want to share my observations and experience in such care. MSF will transfer its functions under the Senior Cluster Network, or SCN, which include the policies and planning of Senior Activity Centers, or SACs, cluster support and caring assistance from neighbors, carers, and other programs such as befriending services to MOH. In Kratai Kim Seng, or KS constituency, my grassroots leaders and I started SACs with the concept of promoting physical, mental, and social well-being of our residents. The first one was started 20 years ago with the help of Tai Hoa Kwan Moral Care. 3 more SACs run by grassroots leaders using the same concept were added over the years at different precincts of our constituency. I've always been an advocate of preventive health care because I'm a medical doctor. Hence, we have applied this concept at our SACs from the very beginning and have practiced it till today. The concept of physical, mental, and social well-being is to facilitate our seniors to stay healthy through having daily balanced nutrition, getting physical activity, and receiving cognitive stimulation. So, daily meals and programs are provided with this aim in mind. Balanced nutrition wards off disease. Physical exercise keeps the bones and muscles strong to minimize falls and fractures and to facilitate good mobility and independency. Social and mental well-being prevents isolation and depression. Together, all these will enable mobile seniors to be active, healthy, and happy, and to remain in the community by warding off frailty and dependency. So while growing in age is a norm, becoming frail with age is not necessarily so. Frailty is a geriatric syndrome where organ function drops below a healthy level. When key organs such as the heart, kidneys, lungs, muscles, and brain start to function below optimal levels, there will be reduced resistance to diseases with increased incidence of incapacity and dependency. The Singapore Longitudinal Aging Studies, or SLAS by NUS, examined 250 seniors above 65. Those who adopted a regimen of good nutrition, physical activity, and cognitive stimulation were less frail than those who did not. In mild cases, their frailty could even be reversed. Those who fulfill only one factor, such as eating well but not exercising regularly, did not fare as well as those who managed all 3. Associate Professor Ng Tzu Pin, who led the study, said, and I quote, "Frailty is not an inevitable part of aging, and with the right intervention, we can reduce the number of elderly who need to seek treatment for this syndrome," unquote. The SLAS which was conducted from 2010 to 2013 and was first published in 2015 in American Journal of Medicine, determined that a healthy diet for seniors is one that has sufficient calories and protein. Professor Ng Zipian explained that with old age, the body becomes less effective in converting amino acids into muscles, causing the seniors to be more susceptible to muscle degeneration. One way to slow down this degeneration will be to consume enough protein. Through my observations over the years, I noted many of our seniors do not consume enough protein. One of the reasons is that protein is more costly. This nutritional deficit is even more pronounced with those seniors living in 1- or 2-room rental flats. SLAS followed 3,000 Singaporean residents aged 55 and above and found that older adults from lower income groups who are single and have no formal education tend to suffer from physical frailty. 41.1% of the frail subjects live in 1- or 2-room public housing. In contrast, 16.7% of the robust ones were living in the other housing types. Since SACs have been catering to seniors living alone in 1- or 2-room rental flats all these years, it would be interesting to find out the incidence of frailty for the seniors living at Indus, Chin Swee, and Kretai precincts. Perhaps Prof. Ng can be persuaded to send his team there for a comparison study. Now that MOH will be taking ownership of the Senior Cluster Network, or SCN, I hope MOH will promote this concept of promoting physical, mental, social well-being of our seniors and keeping them healthy, active, and happy. This will need the concerted efforts of SCN staff and stakeholders coming on board with a shared mission. Execution of the programs daily can run into many challenges as seniors may have their own preferences. For instance, one of our difficulties in our SACs is to get our seniors to do more exercises daily. They prefer more sedentary and fun activities. Some just want to only pick and choose the subsidized daily meals and outings, but are reluctant to participate in daily exercises. Hence, SAC staff must adhere to the concept of physical, mental, and social well-being through coupling the exercise programs with meals, outings, and fun activities to achieve this mission. Incentives had to be introduced over the years to cajole more to take part in the daily exercises. Activity, especially in exercise, is much reduced after retirement for many seniors to the detriment of their well-being. Getting the involvement of grassroots, VWOs, volunteers, and befrienders will add value to SCNs. Community involvements, especially grassroots assistance, will add a human touch and care to the seniors, especially those in need. Taking them to festive activities organized by grassroots can bring cheer to many, especially those living alone. Visiting them, especially by familiar grassroots leaders or befrienders at their homes when they fail to show up at the centers, and giving them medical or social assistance quickly if they are ill are very useful. Occasionally, sprucing up or eradicating bed bugs from their homes by volunteers can help in home care. I'm very glad that Finance Minister has mentioned setting up Community Networks for Seniors, or CNS program, nationwide by 2020. CNS was piloted in 2016 with the aim of connecting different stakeholders in a community to jointly engage and support our seniors. SACs are the choice centers for coordinating befrienders with the seniors and will be a one-stop center for a targeted approach, preventing duplication for the best outcome. I hope to see MOH expanding preventive healthcare and community care by setting up more SACs island-wide, especially at 1- or 2-room housing precincts. Finance Minister also said that AIC will be the central implementation agency to reach out to seniors and their caregivers, as well as coordinate the social and health-related services to them. Aged care providers can now work with AIC as a single agency on the delivery of holistic aged care services to seniors across both the health and social domains. Sir, this is indeed a welcome boon for holistic care services and will enable many who may otherwise need institutional care to remain in their own homes for as long as possible, even despite illnesses or mobility difficulties. Let me elaborate. Preventive healthcare means to prevent getting diseases or disability. Preventive healthcare also means better chance of partial or even full recovery if treatment is provided quickly should one get sick. Mr. Tan, not his real name, age 88, and a member of Chin Sui SAC, suddenly stopped turning up and was missed at the center some 10 years ago. On visiting him, he was found to have suffered a stroke. He was in bed and could not walk. He lived alone. Social help was arranged for his daily living and food was sent to him daily. Physiotherapists visited regularly to rehabilitate him. Within 6 months from being immobile, he could slowly walk again. Today, 10 years later, after his stroke, he's still attending his SAC and the events organized by the KKS grassroots. My appreciation to all my KKS grassroots volunteers here. Best of all, Mr. Tan could continue to live independently by himself, albeit walking with a limp from the stroke episode. I attribute his achieving partial recovery and independence to the appropriate assistance and support given to him at the very early stage of his illness. I have other stories similar to Mr. Tan's, but due to time constraint, I can only mention just this one. With AIC under MOH being the agency in charge of SACs, seniors like Mr. Tan can be referred quickly from the SACs for the assistance required to achieve better outcome. This is vital to prevent irreversible conditions resulting in permanent immobility. Our aging demographic profile will increase the number of seniors that require assistance in their own homes. This is inevitable, especially in precincts with many seniors, such as Chin Sui Precinct. Over the years, many more residents have become housebound due to medical conditions and chronic diseases like diabetes and hypertension. Thus, the need for home care that enables these seniors to remain in their homes. Mr. Heng Swee Kiat launched Aging Gracefully at Home, or AGH program at Chin Sui in 2014. I notice you're nodding, that means you remember that. Thank you. With Temasek Care supporting it for 3 years and AIC since then. I want to register my thanks to both Temasek Care and AIC here. Aging Gracefully at Home, or AGH, is a grassroots initiative of KKS constituency that is intended to benefit weak seniors living alone in HDB rental flats at Chin Sui, Kretai, and Jalan Kuku precincts. It is a holistic care program for seniors who are staying alone and are unable to take care of themselves. AGH provides, when required, one or more of the following services: daily meals, daily supervisions, including daily home visits, befriender services, blood pressure checks, medicine intake checks, home counseling, nursing and home care, transportation to and from hospital, physical improvement in the home. We pair an active elderly AGS befriender with a frail or immobile one AGS beneficiary so that the befriender will visit and socialize with his or her beneficiary each day. We also have a team of full-time healthcare aides and nurses to look after these residents. This program enables seniors who would otherwise be hospitalized or be given some institutional care to remain in their own homes. This program makes seniors happy with graceful aging in place. I hope AIC will be duplicating this at other precincts, especially those with 1 or 2 room flats. In conclusion, sir, let us make Singapore the best place for all our seniors to live in their silver years. Thank you.
Leader of the House.
Mr. Speaker, may I seek your consent to move that the debate be now adjourned?
I give my consent.
Mr. Speaker, I beg to move that the debate be now adjourned.
The question is that the debate be now adjourned. As many as are of that opinion say aye. To the contrary, say no. I think the ayes have it. The ayes have it. Resumption of debate, what day? So be it. Leader, would you like to adjourn Parliament?
Mr. Speaker, I would like now to adjourn the Parliament.
The question is that Parliament do now adjourn to 11 a.m. tomorrow. As many as are of that opinion, say aye. To the contrary, say no. I think the ayes have it. The ayes have it. Order, order.